Well, Kirsten, let me ask you a question.
Yeah.
Can you show us some of the equipment that you're having here to help us?
And tell us what each and every one of them does.
Yeah. So first of all, many people think that insulin pump therapy is a surgery, that I have to have it put inside me, and it's not. Actually, I'm wearing an insulin pump right now, and I wear it on my hip. Or a lot of women will wear it inside their bra. A lot of men will wear it in their socks and loop it up. And so basically what it's going to do, it's going to do two things. There's going to be insulin that's constantly dripping in, sort of like an IV, that goes into my fat or my sub-Q, and it's going in through here, through my stomach in a port. I put this in once every 3 days. So my shot, which I'll show you, is once every 3 days. Instead of 1 shot or 4 shots or more a day.
Now, when you're saying shots, does that have a needle inside?
That does not have a needle inside. It has a little cannula inside. I'll show you what that looks like.
So
that's a great question.
Insulin keeps dribbling from here.
It keeps on dripping in, so it has what's called a basal insulin. Like all day long, that 24-hour insulin is what my body makes. My body always makes insulin, like for people that don't have diabetes, all day, all night. If I were to sleep all day, all night, I'm always making insulin. But when I eat, I need a little squirt of insulin. That's called a bolus. And if I'm going to need a bolus, I just say to the pump, oh, I need some insulin, give me some insulin right now, and this is my bolus, and I get some insulin right now.
So you never get too much of this insulin into your body?
Right, well, I teach people how to do this,
to
get the right amount. Okay. Yeah, I teach people that. So myself and the doctor, we program the basal rate, which is kind of like the cruise control. That's always automatic. You wear this all day, all night. And then when you eat, you tell the pump how much insulin to give yourself with the bolus. Now, when I shower or swim, I just disconnect from my pump. I go shower, and then I come back and connect again. And I turn it off when I'm away.
Right.
But so what I do is the shot, everybody's always concerned about the shot and the needle. So I'll show you what that looks like.
I don't like the needles either.
Anytime. I know, but actually it's really virtually painless. People really, so this is the infusion set. You can see that there is no needle right now.
Yep.
This is where the little connection is going to go. And I'm going to put the blue into the blue. Very easy, and I'm going to take off the paper. I don't risk contaminating the needle when I do this. So again, no needle right now. I'm going to put my hands on the side, and I'm just going to pull down, and then all of a sudden the needle comes up. You can see how small that is. You're like, yeah, it's pretty small.
Yeah, it's small.
It's pretty tiny. So now it's ready to go, but I press the button and it's not going to shoot out because it's on a safety.
Okay.
So I don't accidentally
So where does this shoot now? On any
so now I'm going to put it on any part of my body that I clean. Right? So what I'm going to do is pretend this is my skin.
Yeah.
As soon as I press this foot, it will be released. So I press the foot and I press the button and it goes in. That was my shot. Once every 3 days, instead of more than 3 instead of 2 to 4 times a day. I make a little peace sign and I just lift up,
and the needle stays there.
And the cannula stays inside. After 3 days, I'll just connect my pump to it. Okay, I'm ready to go. Now, after 3 days, I take it off like a Band-Aid.
This is good stuff.
And you can see this is the small little cannula that was inside. Look, it's like an eyelash.
Right.
Okay. Now the other thing for people to know is that the insulin pumps can be expensive, and so health insurances do cover them.
Okay, that's
but
good news.
We have special program for people.
Well, diabetic, and they can get this.
Well, we help the patient with the cost of the pump.
Cool.
Because out of pocket it's very expensive, and most people have a deductible of about $2,000 on average, anywhere between $1,000 to $2,000. So we have a program called the VIP program, and we can help offset the cost by $1,500 for patients.
And how long does this stay?
This pump?
Yeah.
Will last years, like 5 years, 6 years, exactly.
If it's damaged or lost, can you replace it?
There's the warranty, and the warranties are usually good for like 4 to 5 years. So then it gets replaced for free within that warranty time period. We also have a backup pump. And the backup pump is good for 180 days. So we're the only company that offers a backup pump. And we're only, like right now with this special program, the VIP program, that $1,500 plus this backup pump, and we're going to be getting a new pump out in another, I don't know when, because they don't let me know that. They keep it, they kind of like zip it up. It's not FDA approved yet, so I can't say anything. But basically we'll be getting a new pump, so people will get a free upgrade to the new pump and they get to keep their backup pump. The backup pump is really nice for when you travel, because you want a peace of mind in case anything happens. And also, you know, accidents happen. People have dropped this in the toilet or something. So you just send this back to the company, use this for a few days. You don't have to go back to injection therapy or be worried about it. So, so basically, it's a nice convenience, that $1,500, the free upgrade. It's a nice time to purchase the pump for people because it helps offset their costs and they get something brand new in the future.
So when you say 1,500 for those people who are sick and they have no jobs, they depend on unemployment, things like that, because sickness doesn't know whether you have no job or not.
That's very true.
So it sounds a lot of money. Did you say Medicaid can cover this?
Medicare and Medicaid are government programs. The $1,500 does not apply to government-funded programs, so no.
So that is that's something our viewers should have to think about, and they get in touch with the company.
No, what I think what they should do, and I'm sorry,
because I think 1,500.
What I think they should do is still contact Kirsten here, and that way, because she is the expert, she can then guide them to where programs that possibly be able to help them.
Well, what we do, yes, that's true. And what we do is we still get pumps approved through Medicare and Medicaid. They still do cover it. There might be a few hoops we have to jump through, you know, and we always recommend that people are checking their blood sugar, you know, 3 to 4 times a day, because that's really going to help. The Medicare and Medicaid are going to say, oh, that they're really making an effort in their health care.
That's good.
But, you know, exactly, call me. There's a lot of things that we can talk about. Medicare and Medicaid do cover pumps.
Sure. So on that note, I would ask you if you can say your website, how they can get to this one, because I know we are going to have it on the Latinos on the Move.
Yes.
We
are going to have it on todayandnow.org.net.
Yes.
I'm going to put on the web. So you can say that website once more to that people.
Oh, well, actually, I don't know if I can say the website. I've got to get
say it. Yeah.
I can say it. I can say it here.
Yeah.
Okay. Well, I can give you the
just
company.
give them the information where they can reach you.
Oh, where they can reach me. So my cell phone number is the best way to reach me.
Good.
617-335-4594.
Okay.
So 617-335-4594.
Now, do you also have information that that you can leave with us in town, and that's probably in different languages that they would be able to understand or read?
We have English and Spanish.
You see, that's
that's pretty good.
Our community, Spanish.
Yeah.
And
sí, yo hablo español.
So this is very important. And now tell me about, let's talk about school, children. You told me that this is not only for the adults.
That's true.
It's children. How bad is this sickness in schools, among our children?
Yes, well, in the Latino community, all the children born after the new millennium, so 2000 on, 50%, 50, will get diabetes at some point in their life.
Why?
Is that inherited, or is that because of their dietary?
That's bad news.
I mean, it's a combination of both. Remember, there's a genetic component to diabetes. However, there's also the lifestyle. So because our children are so much heavier, they're not as active, and there is a connection with obesity and diabetes. We've got this diabesity problem. It's an epidemic. It really, I mean, more than 26 million people with diabetes and more people with what we call pre-diabetes. So it's a real problem, and we know that the children that are born now will have a shorter lifespan than you or I.
And that's very scary. If it's 50%, you say in the Latino community. What about the African American?
And in the African, that's a great question. I'm not exactly sure of the statistics on that, but they are pretty big. They're probably right up there. In the Caucasian population, at least 30%. And because of the genetic component, I would say that also in the Black and African American communities, it's high.
Yeah. No. I think that what we have to do is start getting our kids away from the computer and the video games that they're playing, and get them to start exercising.
There's a direct correlation between hours watched per day and diabetes and health. We often don't see in children the same health things as adults. You might not see cholesterol go high or blood pressure go high, but you'll see other things. They look at what's called endothelial cells, which are the cells in the lining of the arteries.
Oh.
And you can already see those changes, the cellular changes with children that are overweight.
This
So,
is very
so that's thickening of the arteries?
Well, it's the contractility of the arteries. They don't expand and contract as well.
Right,
And so that means you're not as healthy.
Right.
So if you are watching this, this is bad news. I am scared. I am scared. And if you are watching this, this is for your life. If you are a father or a mother of somebody, please talk to your children. And your children, if you are watching this show, remember this is about your life. Switch off the television for some time. Walk outside, play basketball, run across the street. Just do something which is going to save your life.
But Jobs, they're not going to be watching your show.
No, they watch only Friday, then they go running outside.
Oh, okay.
It's only an hour. Don't stay on TV all the time while watching TV. Go do some exercise at the school, go walk, go jogging around. You don't have to go to the gym lifting things all the time. There are so many ways you can exercise. So please do this for your sake. And this is statistics he gave is very scary. 50% of our population, 20%, that's a big number. We want to stay healthy. We want to live and eat well. So do yourself a favor by living lifestyle which is healthy, at the same time helping you reduce the risk of diabetes. We are only giving you this information for your sake. Mr. Santiago, say something about our leaders. How can they help us? The community
Well,
leaders.
I think we're doing the right thing by getting people like Kirsten here that are going to educate our community and be able to give us the tools necessary for us to be able to combat this disease.
Yeah.
Kirsten, I'm asking you about how much you are connecting with other people, experts like you, teachers, nurses, doctors, community experts. How much are they involved in helping combat this problem?
Well, it's one of the things that I do personally is I sit on a national board, and I'm on the national board of certifying diabetes educators. And one of the things that we want to do is we really want to make sure that the community understands what the difference is between somebody that just says they're an educator in diabetes and a certified diabetes educator. The certified diabetes educators have to go through a lot of different, practicum as well as exam. And so you know that when you meet with a certified diabetes educator that you're going to be getting information that is correct, up to date, and valuable information, as we've been talking about.
But from an expert.
Right, from an expert, really from an expert. And the diabetes educators we're here to support the physicians. And so we're in the process of really trying to partner with American Diabetes Association, American Heart Association, with the exercise community as well. There's American College of Sports Medicine is another one. And everybody is working together. I mean, think about what Michelle Obama is doing for our children right now. And a wonderful, MOVE campaign. And it's what we really need to be doing.
Since we have 2 minutes left, I will ask that the teachers and those coaches who are with our children, please advise the children to exercise regularly. And if you like these experts to come to your school or to your college to talk to the children, get in touch with us. They are going to come and help pass this information. We want to help our children, our elder people, live healthy life. This is how we build our community. We have 1 minute left. I will let you go 1 minute, and we get out of here.
Well, I just,
what do you say?
I want to thank Kirsten for coming and getting in contact with us, and it's really valuable information and resources that you're providing us so that we get in tune with our bodies and our health and be able to live a lot longer than 100 years.
Well, it's such a pleasure to be here, and it's my passion to really talk about physical activity and health and diabetes. And I don't have diabetes, but if I did, I'd most definitely be on a pump. I know I've seen it transform people's lives. People have just been amazed at how great they feel with diabetes. So I just think that that's what I'm trying to do is help people be healthier. And as far as our children go, we need to get our children more active, but we as adults need to lead by example.
Right, exactly.
Thank you so much, Kirsten. Thank you. We will
Thank
invite you again to the show.
Thank you very much.
That has been Today and Now. My name is Job Ombati. I will see you again next Friday at 7:30. Live healthy life. God bless you. Thank you.